Welcome. I'm Barbara Marcum, the Director of Senior Resources for the City of Westland. I have two guests today, Sharon Goodsell and Patty Reid. Sharon is a registered nurse and diabetes educator. Patty is also a diabetes educator, and she's a registered dietitian. So we are going to do a little bit of educating today. We've done a lot of programming on diabetes. So let's talk first about your backgrounds, how long you've been doing what you were doing, what led you to that, and what you do now for people who have diabetes. We'll start with you, Sharon.
Thank you so much, Barb, for letting us come here today and talk about our program at Garden City Hospital. It's Certified Diabetes Educators provide certified diabetes education. The program is certified by the Michigan Department of Health and Human Services and by the American Diabetes Association, which covers all of the insurances to provide reimbursement and quality, accurate, up-to-date information, because it's all research, evidence-based education that we provide. My background, I have been a registered nurse for many, many years. I became interested in diabetes because of some family that I married into. I say I married diabetes because my husband's family has a lot of diabetes, and so I became more and more interested in how it was occurring and how to prevent it and how to manage. And that's my background. Thank you.
Well, I understand too, now that you're talking about that, there are a lot of hospitals that are cutting their diabetes programs. Yours, however, is going strong.
Ours is going strong, has been going strong since 1990, and we're very pleased and proud to provide to the Western Wayne community and beyond quality diabetes self-management education and support. That's a long name, but that is what it is entitled, and that means it's evidence-based, research-based. You're getting accurate quality information.
We're going to do a little bit of that today.
Okay, thank you.
All right, Patty, what about you?
Thank you, Barb. I have been blessed to work with Ms. Goodsell here. She's been an excellent mentor for me. I started in diabetes education because my daughter was diagnosed with type 1 at age 4. I was not a dietitian then. As a matter of fact, I used to work assembly in a factory. And I decided I wanted to do something more with my life. I wanted to make a difference to help people. And what better field with 90-some million people at pre-diabetes and 30-some million at diabetes to provide education so they can empower themselves to make change.
Well, you know, and it's interesting too, a lot of people, I went into gerontology because of my relationship with my grandmother. You had to learn with a type 1 diabetic child all the information, so that was a perfect transition as far as careers go.
Yeah, not one I really wanted that way, but.
Well, exactly. You know, it's interesting because there are so many people with diabetes now, and the numbers are growing, as you were talking about. So education is important. How much do you correlate the amount of education with the successful management of the disease?
Those people who come in and really want to make a difference are the most successful. Those people who set goals and work towards those goals, it's not going to all happen overnight. It's a continuous journey in managing diabetes, because as your life changes, your diabetes management may change. So if you had diabetes education 10 years ago, 5 years ago, 20 years ago, it's now time to evolve to updated information, updated skills, updated technology that can really help you manage your diabetes in a much more successful way.
Well, Patty, just like a lot of other things, as time goes on, we learn more about things. And even like, say, the Weight Watchers program, which is, I had a lot of people who lost a tremendous amount of weight through that program that we offered at one time at the center, and it made a big difference, and a lot of them were on meds for diabetes. And once they started, you know, really going after tackling the weight problem and exercising, we saw a lot of them were taken off their meds. Now, they weren't insulin dependent, okay, at that time, but we saw a big reversal. So is it possible that even though things look gloom and doom, that there is a way to reverse what's been happening?
Well, it's just a different way of managing it, really. Medication is a way of managing diabetes. Changing your lifestyle is a way of managing diabetes, and most health conditions. It's the number one referred method, right, to help manage, but it's the hardest one to do.
Well, don't you think that setting small goals, attainable goals, really helps? So that you get to one phase, you're well aware of what's happening, and then you learn more, and you build that foundation of knowledge, and that's what makes you successful.
Oh, agreed.
Throughout the years.
Absolutely.
So we have some visual aids here.
We do.
And we'll talk a little bit about food and processed food. Enriched products and things like that. So we'll talk with you first, since you are a dietitian, about real natural foods compared to boxed foods and prepared foods.
Okay. I don't think most of us eat enough whole foods, and it is the number one recommended diet or healthy eating pattern that you can follow, eating whole foods. But let's face it, there's a lot of processed food out there.
A lot.
And that's what most of us were raised on. So switching to a whole food diet, like you said, small goals is what we're looking to do. Switching to that whole food diet, that's a big step.
Right.
So often I recommend just making some of those small changes.
Like maybe one meal at a time, like
Exactly.
work on breakfast first and get that down pat, and then maybe work on lunches, packing a lunch rather than going out, I'm not going to say any names, to a fast food place and grabbing something on the way.
Exactly.
So does that tend to work?
Exactly. For many people it does. Sometimes it's just a matter of keeping track of what they eat, even to see what their starting point is. You got to know where you're at to figure out how to get to where you're going. Even Google Maps does that.
Well, I think sometimes when people journal and they start out and they say, I'm going to write down everything that I eat for a week, every day, sometimes they're very surprised when they go back and say, wow, you know what I mean? I didn't realize.
Well, they also, because they're writing it down, it becomes more real. So they tend to make healthier choices also, because now it's in their face. Whether it's electronic or written in pen and paper, they're conscious of it. So they automatically start making some healthier choices.
Okay, so let's look at what we have today. Now, why exactly do we have these particular visual aids?
One, it's some common foods that people eat. Two, they represent 3 different meals, breakfast, lunch, and dinner. They're all balanced plates, meaning they all contain the different food groups, the grains and starches, proteins, fruits and vegetables, dairy. Okay.
I think some people think, okay, if there's a problem with sugar, you see a potato or you see cream of wheat, and you think or bread, I can't have those things, and they try to cut carbs out. Are carbs actually important as far as balance?
They're very important. They're a primary source of energy. So it's like trying to run on little to no gasoline.
Okay, so let's start out with breakfast. Now, some people are not good breakfast eaters.
Yeah, coffee does not a breakfast make.
Coffee does not a breakfast make. I should have listened to you a couple hours ago. So anyway, let's talk a little bit about breakfast and how important it is to get people going.
Okay. Breakfast actually is very important. Research supports people who eat breakfast actually lose more weight because it helps to jumpstart that metabolism. Your hormones are doing a lot of work to wake you up and get you going for the day. They're peaking at that time, so you need to support all that activity in your body. So breakfast is really important. And a balanced breakfast at that. Again, it doesn't have to be a complex thing. I think this is pretty simple here. It could be even a whole grain toast with peanut butter or with an egg. You could have a banana or yogurt perhaps.
So you're really looking at a carbohydrate and a protein.
Well, a couple carbohydrates. Remember, if you have fruit, that's also carbohydrate.
Oh yes, it's funny because some people go through and they don't think about, for example, starchy vegetables. They think vegetables are like a free food. So, but what are some of the vegetables that people have to be careful about?
Well, your portion size matters. So it depends on the food as to what size portion. So she has measuring cups and measuring spoons to demonstrate that you can have a potato the sour cream and the butter and everything else and the bacon that you might put on that baked potato may make it a different choice. But if you have your baked potato the appropriate size, that can be worked into a healthy meal plan.
So when people are looking at particularly diabetes, it does fat or butter or, like you said, sour cream, do those make a big difference as far as sugar, or are you just looking at fats there?
We're looking at overall health because
Okay.
people don't come to us in just one package. They come with multiple other health conditions perhaps. Maybe they have heart disease, maybe they have high blood pressure, maybe they have thyroid problems, arthritis, multiple problems. So we need to take the whole body and work with them as to what they need for their success.
So when you work with patients, do you work with them one-on-one, so you take their particular health issues, or do you work with groups?
We do both.
Okay.
Actually, everybody comes in for what we call our initial assessment, where we sit down with them. I sit down with them, Patty sits down with them, and we go through how they're managing, what their health issues are, what their health concerns are, what their emotional concerns are, and from there we develop an education plan that we can build on. And sometimes we build on that in a group setting where we have maybe 10 people come together and we talk about what's working and not working and give them ideas and tools and tips. And we have a lot of our tools here. Some of them we use one-on-one, some of them we use in a group. It depends on their needs and what way they can be most successful.
So you get the referral from a doctor. So when they do that first assessment with you, how long can they expect to spend there that first day?
From 30 minutes to 60 minutes
Okay.
or more, maybe depending on what their needs are and so forth. So we adjust the schedules based on their needs. Now, insurances sometimes also dictate to us how much time we can have, unfortunately, but we try to work with that as well.
Okay. So after this first assessment, we've already done the breakfast. Let's go on to lunch and making good choices at lunchtime. What are some of your recommendations?
Again, trying to eat with that healthy plate in mind. All of these plates are actually 10 inches in diameter. This one, the red plates just have the extra rim on it.
Yes.
But that blue plate actually fits within the center of that red one. So they're all about 10 inches in diameter. And they're divided by, again, those food groups: non-starchy vegetables, a starch,
Yes.
a protein, we got a dairy there, and then a fruit as well. So just finding the right balance for you and what you can do. It doesn't have to be a whole sandwich and salad and yogurt. It could simply be a salad that has a protein source in it and some carbohydrate along with it. Again, you want balance in what you're doing. And for a lot of people, it might be just actually eating lunch. Many people skip lunch as well as breakfast. So it might be a matter of just working in what you can fit in at that time. Again, we're looking to address your nutritional issues.
These are great plates, and I can see underneath this there are pictures. That really helps someone. Is there a place you can get these?
There's a couple online places. I think there's some stores that actually carry them too, but for the most part online, I think it offers a variety of different
I hated to throw that at you, but I'm looking here and thinking, you know what? For somebody who's just learning, this is really good. Now, as far as green vegetables go, okay, some people may say, that's not enough for me to eat. So, are there things that they can have that won't make a difference with their sugar or with their diabetes? Can they eat more green beans? Can they eat more broccoli?
Yeah, the non-starchy green vegetables, the broccoli, green beans, spinach, cauliflower, all of those are still going to impact your blood sugar, but just not as much as those starchier versions, the carbohydrate versions. And then of course there's those no calorie, low calorie things too that you can fill up on. So regular lettuce, head lettuce, romaine lettuce, that's super low. It's mostly water. So you can do quite a bit of that to help fill you up a little bit too.
Now, do you normally recommend, like they have like the pitas and things like that? So if you put all of what you have in there in a pita and put lots of vegetables in it, would that be okay? Like if you pack your lunch and you don't want to go to a fast food place, can you throw that together and make that okay?
Certainly you can. Certainly you can. It takes a little practice to learn how to do it properly. But again, we're looking to work with people on a one-on-one basis to meet what they can do and what they're willing to change. So if they're doing a pita wrap of some kind, great. Many people think that they have to just do lettuce wraps, that they can't do the pita or the bread, and you can.
Well, that's good to know, because I imagine a lot of people come to you, Sharon, and they're really afraid of failure. That I don't think I'm going to be able to learn all of this, and I'm not sure I'm understanding what I need to do. What is the simplest way that you explain to people when they first come to you about their disease and how eating affects that?
Well, it's not just eating, but we start talking about all the aspects of physical activity and how important that is. So if you go for that walk, that can help you to balance with the foods that you're eating. So if you can start putting two pieces together, sometimes they come in with the medication, then we have three pieces to put together. And to know how well they're working for you, we have meters, and today our meters are getting smaller and smaller, as you can see. They used to be large devices, now they're small devices.
Little Fitbits.
Fitbits, all these types of devices really help us to know what's going on. One of the ones that I really am very excited about, and this is one example, is what we call a glucose sensor. And that sensor placed on your abdomen measures your glucose every 5 minutes while you're wearing it. And
is there a needle or anything in there?
It's so tiny, it's not a needle, it's flexible. It's like a little piece of a thickness of 3 hairs. You can see how tiny that is?
Yes.
That's placed just under the skin. You wear this on, say, your abdomen, and in real time you can see what's going on with your glucose.
All the time?
All the time.
And how long does that last, that little patch?
Well,
like, can you wear it for how long do you want to wear it?
It depends on the company and the manufacturer. FDA has approved them for up to 10 days. So you can wear it for a period of time. You can put a new one on, or we use them for diagnostic purposes. We put it on a patient, have them go home, wear it for 7 to 10 days, come back. We download the report on the computer, print it out. We can see exactly what's going on with their glucose levels during the day, during the night, and then we can focus on, well, you said you were eating here or you went for a walk here. What happened? Okay. We can really zero in on what's going on with them real time.
Now, do you ever see like wild fluctuations?
Oh yes, all the time.
Okay. So
like this?
Yeah.
Yes, up and down, exactly. And that's the enlightening part of using a sensor, is you can see that, and people will say, I didn't realize that was going on. They miss all the highs and lows that were happening in between because they only can check once or twice a day.
Right.
And so this really opens up that. It's like pulling the curtain from behind and seeing what's back there.
Right, and I imagine when they're first diagnosed, that they probably have no clue when it's high, when it's low, what is triggering what. So I imagine that's probably a really good tool to understand your body and how it's working and how different things affect it.
Absolutely. There are people who will come in with symptoms like shaky, sweaty, lightheaded, dizzy. Those are typically indications of low blood sugars, which people with diabetes can have. They can have it too high, too low. They're trying to find that balance
Is
again.
there any sign when your sugar is too high?
Usually you're thirsty, dry mouth, running to the bathroom. Those are the classic symptoms. Mm-hmm. Sometimes it's just fatigue. And everybody says, well, I'm busy, I'm working hard, I'm tired. Not a clue that it could be diabetes. And we have 1 out of 3 adults in Michigan that have prediabetes, and most of them don't even know it. And so those people, the statistics tell us, the research shows us, that in the next 6 years, 30% of those folks are going to develop diabetes if they don't make changes.
But that's, the pre-diabetes thing sounds like it's very promising. Like if you know it and you attack it and you are right on it, that you're going to have some good results. You're at a point where a fork in the road, you can go this way or this way.
Exactly.
And we have a program that's based on the Diabetes Prevention Program, which was a study conducted by the National Institute of Health and the CDC. We've had some wonderful success with that, and we've seen people reach the goals of that program, which include weight loss and healthy eating, physical activity, really changing their lifestyle and their eating habits and their whole approach, mental approach to their health.
So once you become a diabetic, you're always a diabetic. Okay, but if you're a pre-diabetic and you catch it in time and you change your lifestyle, can you avoid diabetes? So
Certainly. This program outperformed medication in reducing risk.
Oh, see, now that's really important, especially when we're looking at you being a mom, our younger kids, and how this tablet thing is. And if I had small children, I'd be doing a half hour a week, because I just think it's detrimental. That sedentary lifestyle is not going to be positive down the road.
Agreed.
Okay.
Are we looking at more children who are, at a younger age, becoming pre-diabetic or diabetic?
Definitely. And it's a scary statistic. The type 2 diabetes was seen in the past as more of an adult onset disease.
Right, exactly.
And now it's impacting our children as well. So we really need to step up as parents and educators and make a difference in those kids' lives and be the example for them.
Yeah, family walks and family, playing activities outside.
Absolutely.
and getting your kids, building your forts. That was my favorite thing, is building a fort when I was a kid. But, playing, and not only that, not only are you doing something great for them, you're spending family time, you're creating that bond together, and you really actually can live a little bit of your childhood over again. So I think it's great to interact with our young people and let them know how important it is to have some fun and doing that outside.
Agreed.
Absolutely.
So now we're at dinner. A lot of people eat out. A lot of people take, the time to have date night, or I'm not going to say reward themselves after having a long work week, but sometimes there are special occasions, and we want to do things that we are what we do every day, but once in a while we want to make an exception. Mm-hmm. Can we do that and still be okay?
Of course we can. There's healthy choices to be made at restaurants. And many of the restaurants are catering more to healthy options. They're offering menus that are
light.
People who have gluten intolerance or a nut allergy or can't do dairy, they have icons on the menus for lower sodium or Weight Watcher friendly or heart healthy, right? Yeah. So, being mindful of those things and really knowing how to balance your plate at home will help you to make the choices when you go out to a restaurant to enjoy.
Well, I think that's important, because we do have to have things to look forward to, and knowing that we can make good choices and still go out and enjoy ourselves, I think, is a really important thing.
Agreed.
Right.
Okay, so during the time that you've been working with people, are they there for a long period of time? Like, is there a way for them to stay connected with diabetes education, or is it kind of a one-shot thing and then they're on their own?
No, absolutely not. It's an ongoing, diabetes follows you through your life, and so we also have programs, the initial diabetes self-management education. Then we also have our support group, which we call Link Up with Diabetes. So that's for people with diabetes, pre-diabetes, family and friends. And we have meetings throughout the year, day and evening, so that they can come and join us, stay updated, new research, share their questions, their challenges, their successes. We love to hear and talk about successes. And so we also have our summer sessions coming up in June and July. They're evening groups. It stays nice and light and later, and so everybody can come and drive and get home safely. And we have that available. They will be on kidney disease and preventing and treating managing kidney disease, and also on cardiovascular disease. So those are coming up. Once a year we have our huge diabetes day, which we had in the Westland City Hall the last couple of years. It's been fantastic. Mm-hmm. Beautiful building, beautiful opportunities for people to meet to talk about diabetes. We bring in speakers and giveaways and lots of fun times. So throughout the year, Garden City Hospital has provided and continues to provide lots of times for people to come together so that they are not living with diabetes by themselves alone.
Yeah, you know, I find the more I've worked with the public that, you know, people don't like to feel alone, that they have something, they really feel isolated. And it's great that, you know, and whether it's caregiving or Alzheimer's, Parkinson's, you know, caregive, whatever it is, when people are in a group, they feel, you know, that they're a part of something a little bit bigger, and they learn so much from the experiences of other people. Wisdom is only something you can gain from living through it. So, you know, the little tips and recipes, and I do this, or I found a great dessert that's like no sugar and it's really satisfying. I mean, I imagine they learn a lot from each other in these groups, and I really recommend those for anyone who is dealing with an issue and they feel alone.
Oh, definitely.
Absolutely.
Definitely.
So I thank you both for being here today. You know, I hope we provided to our viewing audience. So I love the visual aids because, you know, I mean, they're the best. So it's really nice to know and to see because it makes a lot more sense. So I love doing education. That's why we do these shows. And thank you so much for taking time out of your busy days to be with us. And we really do appreciate that.
Thank you, Barb. It was very
Thank you.
thoughtful.
It was
Thank
nice
you.
being with you.
Oh, thank you. It was nice having you. And thank you, friends in the viewing audience, for being with us today.